Something big is happening with Medicare, and you probably haven't heard about it yet. The government is releasing a flurry of announcements, executive orders, and draft policies that could reshape how seniors and disabled Americans get their care. We're talking about cheaper prescriptions, more digital services, and a renewed focus on weight loss as preventative care. And as always, it isn't as straightforward as it seems. And there's a few important deadlines that you need to know about. But first, what's the most frustrating thing about your Medicare or Medicaid coverage right now? Let us know in the comments because your feedback helps us make better videos for you. Okay, so here's what's happening. In just the last few weeks, we've seen more press releases come out of CMS than we usually see in months. There's a clear sense of urgency, and it's not just about paperwork or the usual procedural stuff. They've blatantly stated that they want to fundamentally reshape how Medicare approaches healthcare. Don't believe me? Here's a statement by Abe Sutton, a deputy administrator for CMS. We stand at a defining crossroads in American healthcare with an unprecedented opportunity to protect taxpayer dollars and fundamentally reshape how we approach health and wellness by embracing preventative care, end quote. So why is all of this happening all of a sudden? Why the sudden wave in announcements? The short answer is they can't afford to keep going as it is. According to CMS, the American healthcare system is hemorrhaging money. Healthcare costs are rising 2 to 3 times faster than the economy. 6 in 10 Americans battle at least one chronic disease, and 4 in 10 have multiple chronic diseases. At the same time, Medicare is projected to become insolvent by 2036. Medicare is already the biggest line item in most state budgets. And even with all that spending, our life expectancy lags behind other developed countries, and we're still seeing medical errors rank as the 3rd leading cause of death in the United States. That's not really sustainable. To their credit, CMS is acknowledging that. They're saying that it's time to stop reacting to disease and start focusing on prevention. In their words, we spend too much time and money chasing disease treatments instead of fixing the underlying health behaviors leading to disease. Now, I get that, and preventative care sounds good, but I am a little skeptical because not all disease is the result of underlying behavior, habits, or choices. Sometimes disease is just disease. My little brother passed away a few days ago after a long, courageous battle with multiple sclerosis. He was just 28 years old. He was diagnosed at 16, and before his diagnosis, he was the healthiest, fittest, most active kid I have ever known. His disease was not preventable or avoidable, so when I hear government officials talking about fixing behavior or making us healthier through lifestyle changes, I think, yeah, that's important, that's great, and it's a great goal. There is value in that. But we cannot forget that not everything is preventable, and not every illness is the result of someone's choices. We need to make sure that Medicare and Medicaid stay robust and comprehensive and capable of supporting those who are suffering and need that support. Still, I do think there is some value in what CMS is trying to do, at least in theory. There's a lot of talk about diet and exercise, but they're also looking at how Medicare can support people before things get worse. That includes things like nutrition counseling, chronic disease coaching, and even alternative treatments that may not have been available before. They're planning to begin with what they call a 3-pronged strategy that involves promoting evidence-based prevention, empowering people by making helpful information more readily available, and by encouraging choice and competition. Shortly after that announcement about prevention, CMS issued another press release, this time focused on the role of technology in Medicare. I found this especially interesting because earlier this year, there was a lot of concern that telehealth services might disappear. That March deadline got extended to September, but it left a lot of people wondering what would happen next. And now CMS is signaling that telehealth might not only stick around, it might actually expand. They're asking the public to weigh in on how digital health tools can be used to improve care, reduce paperwork, and help patients manage chronic conditions from home. After all, they said, quote, the agency is seeking public input on how to best advance a seamless, secure, and patient-centered digital health infrastructure. The goal is to unlock the power of modern technology to help seniors and their families take control of their health and well-being, manage chronic conditions, and access care more efficiently, end quote. They're especially interested in hearing how Medicare can improve access to digital tools like health management apps, strengthen the security and portability of your medical records so that you can more easily move those between providers. make health information easier to share between providers and patients, and reduce the administrative burdens for both patients and doctors. Those are all fantastic goals. And they've said that they want to create a health system that is seamless, secure, and centered around the patient. That sounds fantastic to me. And this should be something that makes things easier, not harder for you to get the care that you need. Now, again, these are all good ideas, but the big question is always about implementation. Will these tools be accessible for people who aren't tech savvy? Will the apps actually work? And will telehealth remain covered long-term for people who rely on it? That's exactly why CMS is inviting public comments. They're opening the door for feedback, but only for a very short window, and that's why we need your help. CMS is accepting public comments on the digital health proposal right now. They want to hear from real patients, not just policy experts or industry lobbyists. You can submit your feedback directly to them through their website, and you can get there by going to lirlinks.com/healthtech. That will reroute you to the form where you should be able to input your comments. And again, the deadline for that is June 16th. So if you care about keeping your telehealth, cutting down red tape, or making Medicare easier to use, this is your chance to make your voice count. But that, of course, is not the only change on the table either. While CMS is focused on digital health and prevention, the White House is moving forward with something even bigger, an executive order that could completely reshape how prescription drugs are priced in this country. And as usual, it's a lot more complicated than the headlines may lead you to believe. Now, we know that prescription drugs are where many people feel that pinch the most. Americans pay about 3 times more than people in other countries for the same medications, and drug makers count on those high U.S. prices for the bulk of their profits. Now, the White House has issued a new executive order to crack down on that. It brings back a version of the most favored nation pricing model, which could lower drug prices by 30 to 80%, according to the president. Now, that sounds amazing, but there are a few things that you need to know. First, this idea is not new. A similar proposal was introduced back in 2020, but it never went anywhere because it got tied up in lawsuits. And experts are already warning that this new version will likely face similar challenges. Even if it does move forward, it's mostly expected to impact specialty drugs, things like cancer treatments or infusions, not necessarily the everyday prescriptions that most seniors are picking up at the pharmacy. Michael Ryan is a finance expert who was interviewed by Newsweek, and he put it this way: this is more political promise than practical policy at this point. And I think that's fair. Still, there are some real changes happening, especially through the Medicare Drug Price Negotiation Program. Under this program, CMS is already negotiating the prices of high-cost drugs under Medicare Part D, and now, for the first time ever, they're even preparing to include drugs covered under Part B as well. That means injectable medications, infusions, and other costly treatments could see lower prices, not because of a campaign promise, but because of real changes that are already in motion. Now, the second round of those negotiations is happening right now, and the third round is already being planned. CMS has released draft guidance and is once again asking for public input on how to make these negotiations more transparent and effective for you. The deadline for those comments is June 26th, and you can see more information about that at lirlinks.com/CMS2. So just to recap, here's where we're at. On the one hand, we're seeing some real momentum. CMS is pushing for better preventative care, easier access to digital tools, and lower prices for high-cost medications. They're asking for your input, and for once, it's not just a formality. They've opened multiple public comment periods so that real people, not just lobbyists and companies, can weigh in on this. On the other hand, a whole lot of what's being proposed is still just that. It's all just proposals. Whether any of this turns into lasting change depends on what happens next, and whether the people these programs are supposed to help actually speak up. This is your moment. You don't need to write a fancy letter or use complicated language. You just need to tell them what works, what doesn't, and what you need. But the clock is ticking. If you want to help shape how Medicare works, there is a deadline you can't afford to miss. The deadline to comment on the technology portion is June 16th, and the deadline for the June pricing policies is June 26th. Don't let these deadlines pass you by. And don't forget to check out our other videos for more ways to save money and get free stuff.